Hi, this is April and
Ivette.
here's our buddy Hank. He's going to help us with doing a muscle tour today. He's our guide to what the muscles do and the colors that represent them. Red is for the flexing of the muscles, flexion, yellow extension, dark blue abduction, orange adduction, tan is elevate, and white is rotation. We're starting with Hank's tour on the pelvic girdle. First, we're going to be looking at the piriformis. You can see that the piriformis originates on the anterior surface of the sacrum, and it inserts on the greater trochanter of the femur. Its action is lateral rotation of the thigh. Then we're moving on to the gluteus minimus, minimus meaning little. It originates on the lateral surface of the ilium and inserts also on the greater trochanter of the femur. Its job is to adduct the thigh and rotates the thigh medially. Next, we're going to look at the gluteus maximus, maximus being big. It originates on the posterior ilium, on the sacrum, and on the coccyx. It inserts in the iliotibial tract and gluteal tuberosity of the femur. Its action is to extend the thigh at the hip, to rotate the thigh laterally, and abduct the thigh. And moving back to the front of the pelvic girdle, we're going to be looking at the tensor fascia latae, or also known as the TFL. It originates on the anterior superior iliac spine and iliac crest, as Ivette is noting here. Its insertion is in the iliotibial tract, and its job is to flex the thigh at the hip, abduct the thigh, and rotates the thigh medially as well. Moving on to the inside of the pelvic area, we have the iliacus. The iliacus originates in the fossa and along the sacrum. It inserts on the femur at the lesser trochanter. It also assists in flexing of the thigh. The psoas major is also in this area. It originates on the body of T12 and L1 through 5 on the vertebral bodies. It inserts into the lesser trochanter of the femur, and its action is to flex the thigh, lateral rotation of the thigh, and lateral flexion of the trunk. Now we're going to move on to the adductors. First of all, we're going to look at the our pectineus. Its origin is on the superior ramus along with the body at the pubis. It inserts at the femur, and one of its jobs is to adduct the thigh, flexion of the thigh, and medial rotation of the thigh. The adductor brevis originates on the inferior ramus of the pubis and the body of the pubis. You'll notice that it inserts at the linea aspera of the femur on the back and adducts the thigh, rotates the thigh medially. The adductors all kind of do that same job of adducting the thigh and rotating the thigh. Next, we're moving on to the adductor magnus. Its insertion or origin is in the inferior ramus of the pubis, the ischial ramus, and the ischial tuberosities. Again, this one inserts at the linea aspera of the femur. And once again, it adducts the thigh, rotates the thigh laterally, and flexes the thigh at the hip. On to the adductor longus. Its origin starts at the pubis near the pubic symphysis. Once again, going back to the linea aspera of the femur, and adducts the thigh, flexes the thigh at the hip, and rotates the thigh immediately. Now we're moving on to the anterior portion of the thigh. First we're looking at this sartorius. It originates on the anterior inferior iliac spine, as noted here. You'll notice that it inserts on the medial tibia, clear down there. Don't want to tear that one. Its action is to flex the thigh at the hip, rotates the thigh laterally, and flexes the leg at the knee. So if you're going to kick somebody, you're going to be using that one. Moving on to the gracilis. This gracilis is also in orange, noting that it's an adductor. It originates on the inferior ramus and body of the pubis. It inserts at the medial surface of the tibia as well, so it's another long one. It adducts the thigh, flexes the leg at the knee, and rotates the knee medially. Now we're moving on to the vastus group of muscles. First we have the vastus lateralis. One thing I want to mention about all of these, they all tie into the same area, the patella and tibial tuberosity, through a tendon of the quadriceps femoris and the patellar ligament. So the first vastus lateralis, it originates on the greater trochanter of the femur and the introcantric line along with the linea aspera of the femur. And it inserts as I previously described. One of its jobs is to extend the leg at the knee, good for kicking, and flexing the thigh at the hip. So if you're one of the dancing girls, you'll be using these muscles a lot. Next we're going to move on to vastus medialis. Vastus medialis originates in the linea aspera of the femur in the intertrochanteric line, and it also inserts at the patella and tibial tuberosity as I previously described. This is another one that is good for extending the leg at the knee, and it also stabilizes the patella. That would be your little knee bone. Moving on to the vastus intermedius. Vastus intermedius, it originates on the shaft of the femur. Once again, tying into the same patella tibial region. Moving right along, we're going to look at the rectus femoris now. It originates on the anterior inferior iliac spine that we know so well by now, and inserts back down there at the patella and tibial tuberosity. Again, this muscle helps extend the leg at the knee and flexes the hip at the thigh. Okay, moving into the back thigh region, we're looking at the biceps femoris. It has the long head that originates on the ischial tuberosity, while the short head initiates on the linea aspera. The head of the fibula is where it inserts along with the lateral condyle of the tibia, as you can see here. One of its jobs is to extend the thigh at the hip and again flexes the leg at the knee and rotates the leg medially. Another good dancing muscle. Moving right along to the semitendinosus, it originates at the ischial tuberosity and inserts at the medial tibia, as you'll see here. Again, acts to extend the thigh at the hip, flexes the leg at the knee, and rotates the leg laterally. And sometimes when you're injured, your semimembranosus comes off. However, our surgeon, Ivette, is going to hold it in place for the purpose of this demonstration. We're talking now about the semimembranosus, whose origination is on the ischial tuberosity. If you get it sewed back in the right place after the injury, the medial condyle of the tibia is where it inserts, and hopefully with this injury you can continue to extend the thigh at the hip, flex your leg at the knee, and rotate the leg medially after your wonderful surgical repair. Fine looking leg. We're going to look now at the tibialis anterior. It happens to originate at the lateral condyle of the tibia and the interosseous membrane, which happens to be between the tibia and fibula, which you cannot see reflected here. It inserts at the medial cuneiform and the first metatarsal, clear down there on the foot. Its action is to dorsiflex the foot at the ankle, getting that dancer's foot going. Moving on to the perioneus, we have the longus and the brevis. The head of the fibula and distal fibula are where it originates, again with the interosseous membrane. It inserts on the medial cuneiform and the first metatarsal, while the brevis anchors at the fifth metatarsal. The action for this muscle group is to plantar flex the foot at the ankle and everts the foot, which is a sideways action which Hank isn't quite capable of doing. Moving on to the soleus, the origin is on the proximal tibia and proximal fibula, and is incorporating the interosseous membrane as well. It inserts on the calcaneus, which goes down and inserts through the ankle with a tendon. Its job is to plantar flex the foot at the ankle as well, which this dancer really appreciates the ability to do. Look at the gastrocnemius, which originates at the lateral and medial condyles of the femur, and it also anchors or inserts at the calcaneus, which is down along with a tendon down there on the bottom of the foot. Its job is also to plantar flex the foot at the ankle. And finally, we come to the tibialis posterior. It originates at the proximal tibia and fibula, and once again at the interosseous membrane on the lower leg. It inserts on the navicular bone and at the second through the fourth metatarsals, as you can see here. The action is to plantar flex the foot at the ankle and inverts the foot as well. And there you have it, Hank's lower section.
So we're going to start with the scapula muscles. And the first one's the levator scapulae, which originates from the transverse process of C1 through C4. It inserts to the vertebral border of the scapula, and the action is to elevate the scapula and rotate the scapula down. The next one is the rhomboid minor. It originates from the spinous process of C7 through T1, and it inserts to the vertebral border of the scapula. The action is to adduct the scapula and rotate the scapula down. The next one is rhomboid major. It originates from the spinous process of T2 to T5, inserts at the vertebral border of the scapula, and the action is to adduct the scapula and as well rotate the scapula down. Next, we'll be doing the pectoral girdle muscles. We'll start with the supraspinatus muscle, which originates at the supraspinatus fossa of the scapula. It inserts to the greater tubercle of the humerus, and the action is to abduct the arm. The next one is the infraspinatus. Originates at the infraspinatus fossa of the scapula, inserts to the greater tubercle of the humerus, and the action is to rotate arm laterally. Next is the teres minor, which originates at the lateral border of the scapula, there, kind of hidden, inserts to the greater tubercle of the humerus, and the action is to rotate arm laterally. side to side. The teres major originates at the inferior angle of the scapula, inserts at the lesser tubercle of the humerus, and the action is to adduct arm, rotate arm medially, and extend the arm at the shoulder blade. We'll continue with the subscapularis, which originates, kind of hidden, but it originates at the subscapular fossa of the scapula and inserts at the lesser tubercle of the humerus. Its action is to help rotate arm medially. Next, we'll do the trapezius, which is in the back, posterior side. And that's that long, big one. It originates at the occipital bone and the spinous process of C7 to T12 and inserts to the lateral, kind of 1/3 of the clavicle spine of the scapula and the acromion process of the scapula. Its action is to elevate the scapula. The latissimus dorsi originates from the spinous process of T7 to T12, the ribs 9 to 12, iliac crest, inferior angle of the scapula. Inserts to the interbercular groove of the humerus, and the action is to extend the arm at the shoulder, rotate arm medially, and adduct the arm. Next, we'll go to the pectoralis major. It originates at the sternal end of the clavicle and rib 1 to 6. Inserts on the greater tubercle of the humerus, and its action is to flex the arm at the shoulder, rotate arm medially, and adduct the arm. Next, we have the pectoralis minor, which originates from rib 3 to 5 and inserts to the coracoid process of the scapula. Its action is to depress the scapula and rotate the scapula down. Next, side to the pectoralis minor, it's deltoid, which originates 1/3 of the clavicle spine of the scapula and the acromion process of the scapula, and inserts to the deltoid tuberosity of the humerus. Its action is to adduct the arm, flex and bend at the shoulder, rotate the arm medially, extend arm at the shoulder, and also rotate laterally. Then we'll go to the muscles of the anterior and of the posterior compartment of the arm. We'll start with the biceps brachii, which originates, the long head originates at the supraglenoid tubercle of the scapula, and the short head at the coracoid process of the scapula. It inserts at the radial tuberosity of the radius, and the action is to flex the forearm at the elbow and also supinates forearm. The brachialis, it originates at the anterior part of the humerus, and it inserts at the coracoid process of the ulna. It's used to flex the forearm at the elbow. Fora brachialis, which originates at the coracoid process of the scapula, inserts at the medial part of the humerus, and it's used to flex the arm at the shoulder and adduct the arm as well. The last one is the triceps brachii, which originates, has two portions, the long head, actually three, the long head being the infraglenoid tubercle of the scapula, and the lateral and medial head originates at the posterior part of the humerus. It inserts to the olecranon process of the ulna, and it's used to extend the forearm at the elbow.